Good afternoon, everyone. Today is our briefing for February the 11th, and we are joined by Dr. Davis, who will be answering questions as well as I will be, and talking a little bit about our hospitalizations and our case rate number, and of course, continue to talk about vaccination rollout, which I'm going to do in just a minute. Want to just begin by noting that we are now at 754 deaths that we have lost due to COVID-19. It's a tragic number. These are families. The number and the rate of which we are losing people, of course, has been really hard to see over the last month or two, and we can expect that number to continue to go up. Now, fortunately, of course, all the indicators around hospitalizations and case rate are all going in the right direction and going down, but we'll still continue to lose folks as we move forward, and our prayers and love are with the family. But we are heartened by the positive hospitalization data, which Dr. Davis will talk about. I want to also now get into our vaccination process and kind of where we're at and what's happening next. So I want to just start by saying that our Long Beach vaccination team is really doing a phenomenal job at the health department. We are, I believe, and we've been told by the state and others, that we really are a statewide model and the way we have rolled out our vaccination process. There are still a lot of programs that we're rolling out as it relates to vaccines, which we'll talk about. We have now hit about 60,000 doses that we have administered in Long Beach. That's, of course, a significant number, and that number will continue to increase. And as we look at that 60,000 number, we have to think about who's getting those doses. Of course, our healthcare workers, our emergency workers have. And now we, of course, have vaccinated our 65-plus seniors, which happens every day, our nursing home residents, and most recently, of course, teachers, faculty, school staff, and food and grocery workers. And so those are all folks that are in that 60,000 doses. And, of course, we are now midway through second doses. So we are going every day. I just came back from our convention center site where we're vaccinating folks that are now in their second dose. And so we're really happy to see that. As a reminder, because of our planning, we have not had issues that we've seen in other places. We are not running out of doses. We're not canceling appointments. We are not throwing away vaccine at the end of the day. We have a well-run operation that the health department is doing a phenomenal job at running. And so what's kind of coming up down the pipeline? So what's happened this week, as we've seen, is we launched a lot of our equity clinics. So last weekend and throughout the week, we've started vaccinating and going into neighborhoods. We vaccinated maybe approximately 500 Spanish-speaking only residents last weekend who noted Spanish in VaxLB as their main form of communication. We vaccinated, I think, a few hundred seniors yesterday, Black seniors from within the community in their neighborhood. At a local church. And for a lot of folks that don't know, this country also has a very dark and horrific past as it relates to Black Americans and the vaccine. And so to go into a neighborhood, to go into a church and provide that service there, I heard directly from those seniors how much of a positive experience it was for them and that they felt safer and more secure getting the vaccine in their home church with their pastor right there. So we'll continue to do those clinics. We have a Khmer speaking for our Cambodian community equity clinic coming down the pipeline, as well as more Spanish speaking ones. So that work will continue on top of all of the regular senior clinics we're doing every day. I want to thank Memorial Hospital. They host our 65-plus senior clinic that happens there. There are folks there today getting vaccinated. There are folks there yesterday. There'll be folks there again tomorrow. And those folks we're pulling straight from that VaxLB list. They get sent to Memorial, and they continue to do the vaccination. So please remember that we are vaccinating everyone within this tier, and that includes the folks that we're doing the most of, which is our 65 and over seniors. If you are in VaxLB, or if you're a senior, or you have a parent or grandparent, and are wondering when their turn is up, just please know that as long as you're in the system, those names are being pulled from earliest that have signed up as we move forward. And so those names are just getting pulled out the list, putting into the system, getting vaccinated, then the next group, and then the next group. So we are getting through everyone, and your name or your family member's name will get called as long as you're in the system. Again, that's the VaxLB system online. I want to now turn to education. More than any health jurisdiction in the state, we have, I think, by far vaccinated more educators, from a city perspective, and that includes, of course, community college and Cal State. It includes a lot of our independent schools, our parochial schools, and Long Beach Unified. And I want to talk about Long Beach Unified here in just a minute. So Long Beach Unified educators have now gone through multiple clinics. In fact, tomorrow we're doing even more LBUSD educators. And I want to just also note today that we've just let Long Beach Unified know that we are providing them with enough doses for them to complete all of their pre-K through K2 teachers and staff. And so they will be next week finishing their K2 all the way through K2, and we think soon after that we'll be able to finish off all of through K5. And so this gives the school district an opportunity to ensure that teachers are vaccinated in the classroom, that staff are vaccinated, that those folks that are on campus now are vaccinated. And so we are excited to by next week have our K2 educators complete. Of course, many teachers and staff have already been vaccinated, and we want to make sure that our educators know that we're here to support them and help with vaccinations as much as possible. I want to thank the school district for their partnership, and they're doing everything they can to get people vaccinated as soon as possible through our allocations. Of course, we want to vaccinate more and we want to do it faster, but we can only do as much as we get from the state and the federal government. And so there is still a national shortage. We have yet, of course, and don't plan on in being in a position where we stop vaccinating. We will continue to do so, and we've planned well, and that, of course, will continue. I also want to note that we are integrating now with some changes at the state level. So the state is changing to a new healthcare system operator. We're working with them to adjust, and they're also launching and have launched a new kind of notification system, and so we're also working to integrate our VaxLB system into that system. Let me give a note about second doses. There's a lot of folks that have been contacting the health department or myself and others about their second dose. Just as a reminder, the date on the card per the CDC is the earliest date that you can get the dose. It's not necessarily the date of your dose. And so if you're a few days away from that date and you start worrying about, well, where's my appointment, the health department will email you your appointment. I think for almost everyone up to this point has received that second dose on the date of the card or a day or two after that date. And so that's our expectations, and please don't worry, we're getting everyone their dates, but there are, of course, thousands and thousands of folks that we're trying to schedule. And so if you're waiting for your second dose, you will get it through the city of Long Beach at the same location where you got your first dose, the same system. If it was at the health department, it'll be at the health department. We'll tell you where to go when we send you your email. And again, if you have a second dose concern or if you have a question, it's best to call 570-INFO, 570-INFO, and we will get back to you, and we have a full team at the hotline to answer questions, and we'll continue those second doses and the first doses that are moving forward. And so I want to remind everyone the pandemic is not over. We have a lot of work to do still ahead, but we are optimistic about where we're going with vaccines, and that 60,000 dose number is going to pretty soon be 70 and 80 and 100. And when we start getting into those numbers, we've seen a significant portion of our population starting to get vaccinated. So we are excited about that. Let me turn it over to Dr. Davis, and then of course we'll take any questions. So, Dr. Davis. Dr. Davis.
Thank you, Mayor Garcia. Good afternoon, everyone. As of today, we've crossed the 50,000 mark in terms of COVID-19 cases. A total of 50,072 residents, which is just over 10% of Long Beach's total population, have tested positive for COVID-19. We continued to see fatalities from people who were infected during the height of our surge in December and January. To date, we have lost 754 Long Beach residents to COVID-19. 248 residents are currently hospitalized, and our positivity rate has thankfully decreased. As of today, it is 7.6%. So I'd like to give you a few updates about our updated health order. Yesterday, we issued an updated health order allowing indoor, in-person religious services and cultural ceremonies to resume with restrictions. This update was issued to align with recent changes to the state's blueprint for a safer economy, Purple Tier, issued by Governor Newsom. As part of this updated health order, places of worship, including churches, synagogues, mosques, and temples, and cultural ceremonies such as weddings and funerals may resume indoor, in-person services limited to 25% maximum indoor capacity. Singing, chanting, and other practices and performances are prohibited for indoor gatherings, as there is a significant increase risk of COVID-19 transmission with these activities. These activities are also strongly discouraged during outdoor gatherings. Service of food and beverages, potlucks, and family-style eating and drinking events remain prohibited due to risk of transmission. I also want to note that restaurants and hotels hosting weddings and funerals are still required to host events outdoors only in accordance with state guidelines. While indoor in-person services may resume with these restrictions, it remains critical that all possible steps be taken to limit the spread of COVID-19 and ensure the safety of everybody in the community. People participating in these activities, in indoor worship and religious activities, should remain vigilant in practicing physical distancing, wearing a face covering whenever you're in public or in these indoor activities, and frequently washing your hands and sanitizing high-touch surfaces, and making sure that you don't participate in any indoor activities if you're not feeling well, that you stay home. The updated health order also includes alignment with the state of California's guidelines for reopening in-person instruction for K-12 schools. Schools in the city of Long Beach may reopen for K through 6 classrooms for in-person instruction once Long Beach, LA County, Los Angeles County reaches certain requirements within the Purple Tier. To meet those requirements, the county needs a case rate of fewer than 25 cases per 100,000 for at least 5 consecutive days. We're not there yet, but with your help, we hope to get to a place soon where we can reopen in-person classrooms again. Some reminders about celebrating safely. I want to take a moment to thank everyone who celebrated safely over Super Bowl weekend. We'll see within the next week or so if there's an uptick in cases following this last weekend with the Super Bowl. But I was encouraged of all the people that I heard that celebrated safely, stayed in their household, celebrated outdoors with a small number of people, wore their masks, refrained from gathering in large groups. We want to see the new daily cases continue to fall, and we want to see our ICU capacity continue to grow. This coming weekend is also a cause for celebration for many, with both the Lunar New Year, Valentine's Day, and President's Day weekend all falling on this weekend. As we look toward this weekend, celebrating Lunar New Year, Valentine's Day, and President's Day, we urge everyone to continue wearing a mask when you're in public, stay at least 6 feet away from others when you're not in the same household, and wash your hands frequently. Avoid large crowds and large gatherings. If you're dining outdoors or you're participating in a Lunar New Year festivity or a religious activity, we strongly encourage people to do so with only members of their household, their immediate household, and to try to avoid large crowds. It's also very important to continue all of the precautions, such as wearing a mask, maintaining 6 feet of physical distance, and washing your hands often. If you feel ill, please stay home. While we continue to distribute the vaccine to as many people as we are able, we still don't know if the vaccination prevents the asymptomatic spread of COVID-19, and we also don't know how long the immunity from the vaccine lasts. Because of this, and because we also have some unknowns about this new virus, such as what type of variants may be circulating in our community, it's going to be very important that no matter whether you've been vaccinated or not, that you continue all of the safety precautions for the next several months, if not longer. So whether you've had 0 doses of vaccine, 1 dose of vaccine, 2 doses of vaccine, it'll be really important for the next several months to continue wearing a mask, physical distancing, not gathering, staying home when you're sick, avoiding travel. We all need to continue to do our part and take these precautions, even after we're vaccinated, to ensure the safety and well-being of everyone in our community. Thank you. I'll turn it back over to Mayor Garcia.
Thank you, Dr. Davis. We will now move on to media questions. As a reminder, there will be time for 1 question each. Any additional questions can be asked through the Long Beach Joint Information Center. Dr. Davis, these next couple questions are for you. First question comes from Melissa at the Long Beach Post. Melissa, go ahead and unmute and ask your question.
Hi, Dr. Davis. So I think just to clarify on the adjusted case rate, it's the county's case rate that matters when it comes to school reopenings. Because I know the city reports that number on the daily media releases, and I'm just wondering how we should treat that number that's on the city releases as it relates to school openings. Because it looks like the city's case rate's about 35, but I don't know if that's a good barometer when it comes to the ability of schools to reopen. Can you just clarify that?
Yeah, so thank you for the question. The state is who determined how school districts would be able to open and what criteria that they needed to follow or to hit what thresholds. And they decided that it was going to be done at a county level. And so for the purposes of reopening for any school within the county of Los Angeles, including the city of Long Beach, we have to follow, all of us have to follow the Los Angeles County case rate. And when it's below 25 cases per 100,000 for 5 consecutive days, then that's really the trigger that allows schools to apply to reopen by doing a COVID-19 safety plan that they would submit to their local health department. So if you're a Long Beach school, that would be to Long Beach Health and Human Services, and then we would approve you to open. So the number we're using is the county number. And then after that, after the county hits that number, then you follow Long Beach directions. And we're following the guidelines of the state. So you would do what the state says, and then you would submit all of your information to Long Beach Health and Human Services.
Thank you, Dr. Davis. Next question comes from Haley at the Press Telegram. Dr. Davis, can you speak to any updated data or information on how the vaccine has been distributed across racial groups?
So I know that things are improving and that we have been making focused efforts to provide access, better access and equitable distribution in numerous communities, including communities of color. The mayor spoke to some of those. We had a vaccination event yesterday that vaccinated approximately 200 people that was focused in the African-American community. We have one coming up for the Khmer speaking community, the Cambodian community, and we had one in the past for Spanish speaking communities. and we'll have several going forward as well. And so, as we know, it is a national issue to make sure that we're being equitable and to increase and improve equity in these populations. And so we are working really diligently to address those issues here in Long Beach.
Thank you, Dr. Davis. That concludes our media questions. We will now move on to Spanish interpretation.
Buenas tardes. Hoy es nuestra sesión informativa del 11 de febrero de 2021. Hoy me acompaña la doctora Anissa Davis, nuestra funcionaria de salud de la ciudad, quien proporcionará información actualizada sobre nuestra orden de salud revisada, las cifras de COVID-19 y otra información importante sobre la prevención. Pero primero, voy a darles una actualización de nuestra administración de la vacuna, que incluye estadísticas de vacunas, distribución y el tema de equidad. Long Beach sigue haciendo un trabajo asombroso para hacer llegar las vacunas a la gente que más las necesita. A la fecha de hoy, nuestro Departamento de Salud ha administrado 28.467 dosis de vacunas y más de 59.714 dosis de vacunas en total aquí en la ciudad de Long Beach. Desde nuestra última actualización, se han administrado un total de 11.839 vacunas en la ciudad. Mientras seguimos dando prioridad a las segundas dosis para aquellos que recibieron ya su primera dosis en enero, también seguimos centrándonos en la vacunación de nuestra población de adultos mayores a través de nuestro Departamento de Salud y nuestra asociación con el Centro Médico Long Beach Memorial Care y la BA para los veteranos de servicio militar, además de nuestros socios de atención médica sin fines de lucro. Como ya han de saber, también hemos empezado a vacunar a nuestros educadores en la ciudad de Long Beach. La vacunación de cuidadores de niños y de los maestros es fundamental para que los estudiantes vuelvan a la escuela, a las clases. A partir de esta semana, hemos ofrecido suficientes dosis para cubrir a todos los maestros del Distrito Escolar Unificado de Long Beach, desde el jardín de infancia hasta el segundo grado. También seguimos vacunando a los educadores de Cal State University Long Beach, CSULB, así como a los trabajadores del sector alimentario. Pero nuestros esfuerzos no se han detenido ahí, ya que seguimos adoptando un enfoque de equidad en la distribución de vacunas aquí en Long Beach. El pasado fin de semana, nuestro Departamento de Salud realizó su primera de muchas clínicas de vacunación móviles y comunitarias que se llevan a cabo como parte de las campañas de la ciudad a las personas de los barrios de alto riesgo e históricamente desatendidos. Este primer evento tuvo lugar en el Parque Silverado, en el cual se atiende principalmente a nuestros adultos hispanohablantes de 65 años o más. Allí proporcionamos más de 500 dosis de vacunas. Ayer vacunamos a unas 200 personas de la tercera edad, ancianos afroamericanos de nuestra comunidad, mediante una asociación con líderes religiosos y la NAACP. Estas clínicas móviles seguirán centrándose en barrios históricamente desatendidos de la ciudad de Long Beach, con nombramientos seleccionados entre los inscritos en la plataforma VAXLB, VAXLB grande, o realizados en colaboración con organizaciones locales sin fines de lucro y socios comunitarios que sirven a estas comunidades. La ciudad sigue identificando más oportunidades para atender a las comunidades más afectadas por la COVID-19. El dispensario móvil de vacunas empezará pronto a vacunar a personas confinadas en sus casas y a centros de ancianos, y seguiremos haciendo esto hasta que se satisfaga toda la necesidad. El número de personas que se vacunan depende totalmente de la asignación de estas que recibamos cada semana. Seguimos trabajando enérgicamente con el Estado y el gobierno federal para recibir la mayor cantidad de vacunas posibles. Sabemos que muchos de ustedes en otros sectores siguen esperando pacientemente su turno para recibir la vacuna. Les agradecemos a todos su paciencia y les animamos a que consulten con su proveedor de servicio de salud y su empleador para conocer la disponibilidad de la vacuna e información sobre cuándo les tocaría recibirla. También animamos a todos a visitar la plataforma, la página VAXLB, que es el portal de vacunación en línea, para inscribirse y que se le notifique cuando le toque su turno. El sitio y el formulario de inscripción están disponibles en inglés, español, tagalo y jemer. Puede ir a longbeach.gov/B/VAXLB para inscribirse. Las personas que no tienen acceso a Internet pueden llamar al 562-570-INFO, INFO, para obtener ayuda de cómo inscribirse. Y para cerrar, la pandemia está lejos de haber terminado, pero sigo sintiéndome más y más esperanzado a medida que avanzamos en el proceso de despliegue de la vacunación. Me gustaría recordarles a todos que por favor continúen utilizando sus mascarillas, cubiertas faciales, manteniendo el distanciamiento físico adecuado y limitando las reuniones con personas ajenas a su hogar, a su casa. Estamos en un punto de cambio, de gran cambio, de inflexión, y estamos superando esto juntos. Gracias por poner de su parte para mantenernos a salvo a todos, incluyendo ustedes mismos. Gracias.